ഹലോ ഫ്രണ്ട്സ്, പുതിയൊരു വീഡിയോയിലേക്ക് ഏവർക്കും സ്വാഗതം. സ്കിന്നിൻ്റെ ട്രീറ്റ്മെൻറ്റുമായിട്ട് ബന്ധപ്പെട്ട് ഏറ്റവും കൂടുതൽ യൂസ് ചെയ്യുന്നൊരു മെഡിസിനാണ് സ്റ്റിറോയിഡ്സ്. സ്റ്റിറോയിഡ്സ് എന്നത് കൂടുതൽ സൈഡ് എഫക്റ്റ് ഉണ്ടാക്കാൻ സാധ്യതയുള്ള മെഡിസിനാണ് എന്നൊരു ബോധം ഇന്ന് സാധാരണ ജനങ്ങൾക്കിടയിൽ പോലുമുണ്ട്. അതുകൊണ്ട് തന്നെ മെഡിസിൻ ഡിസ്പെൻസ് ചെയ്യുന്ന സമയത്ത് നമ്മൾ മിക്കവാറും തന്നെ നേരിടേണ്ടി വരുന്ന ഒരു ക്വസ്റ്റ്യനാണ് തങ്ങൾ മേടിക്കാൻ ഉദ്ദേശിക്കുന്ന അല്ലെങ്കിൽ ഡോക്ടർ പ്രിസ്ക്രൈബ് ചെയ്ത ആ ഒരു മെഡിസിനകത്ത് സ്റ്റിറോയിഡിൻ്റെ കണ്ടൻറ്റ് ഉണ്ടോ എന്നത്. അവരുടെ ഈ ഒരു ക്വസ്റ്റ്യൻ ആൻസർ ചെയ്യണമെങ്കിലും ഇനി സ്റ്റിറോയിഡിനെ കുറിച്ചിട്ട് അവർ അതിൻ്റെ യൂസ് ചോദിച്ചാലോ, അല്ലെങ്കിൽ അത് എത്ര നാൾ യൂസ് ചെയ്യണം എന്നത് ചോദിച്ചാലോ, അതല്ലെങ്കിൽ അതിന് ഉണ്ടാകാവുന്ന സൈഡ് എഫക്റ്റ് എന്തെന്ന് ചോദിച്ചാലോ ഒക്കെ നമ്മൾ പറഞ്ഞു കൊടുക്കണ്ടായോ. അപ്പം നമുക്കതിനെക്കുറിച്ചിട്ട് ഇന്നൊന്ന് നോക്കാം. ഇന്നത്തെ വീഡിയോയിലുള്ളത് ടോപ്പിക്കൽ സ്റ്റിറോയിഡ്സിനെ കുറിച്ചിട്ടുള്ള ഇത്തിരി അറിവുകളാണ്. ഇവിടെ ഫസ്റ്റിലെ നമ്മൾ ചിന്തിക്കേണ്ട ഒരു കാര്യം, വാട്ട് ആർ സ്റ്റിറോയിഡ്സ്? സ്റ്റിറോയിഡ്സ് ആർ corticosteroids. These are man-made drugs that closely resembles cortisol. Cortisol is a hormone that is produced by adrenal gland. Steroids work by decreasing inflammation and reducing the activity of immune system. Steroids are used to treat a variety of inflammatory diseases and conditions, such as rheumatoid arthritis or lupus, which are caused by immune system mistakenly attacking the body. Here, steroid acts as an anti-inflammatory agent by inhibiting the transcription of inflammatory and immune genes. ഇനി നമുക്ക് ടോപ്പിക്കൽ കോർട്ടിക്കോസ്റ്റെറോയിഡ്സിനെ കുറിച്ച് നോക്കാം. Topical corticosteroids are a type of steroid medicine applied directly to the skin to reduce inflammation and irritation. Topical corticosteroids are available in several different forms, including creams, ointment, lotion, gel, and foams. They are used to relieve skin conditions that cause skin inflammation and irritation. When used as directed by our healthcare provider, topical steroids are a safe and effective way to treat conditions such as eczema, psoriasis, and atopic dermatitis. Topical steroid can be prescribed or purchased over the counter. Inflammation is a sign of an immune response. Topical steroid is applied to an affected area of the skin to help reduce symptoms such as rashes, scaly patches, itching, pain, redness, and swelling. For example, eczema, also known as atopic dermatitis, is a group of skin conditions that lead to itchy and inflamed skin with a scaly rashes. Eczema is a common in children. If you experience a flare-up of eczema, you can apply a cream to help to stop scratching the area and allow the skin to heal. Topical steroid is also used for the treatment of other skin conditions such as psoriasis, seborrheic dermatitis, and contact dermatitis. Psoriasis is an autoimmune disorder that causes scaly patches of the skin. Seborrheic dermatitis is a skin rashes with red patches and greasy yellow scales that typically affected the scalp. Contact dermatitis is a red rashes caused by contact with a substances that irritate the skin or cause an allergic reaction to it. The strength of a topical steroid is determined by a test that measures how much it can cause our blood vessels to constrict in the upper part of the dermis. As blood vessels constrict, it can reduce swelling and discomfort. What is dermis? Our skin has two main layers, an outer layer called epidermis and the inner layer is called dermis. Topical steroids are available in both oily and non-greasy preparations. Type prescribed varies based on the area of the skin where it will be applied. Creamy preparations of topical steroids are most commonly prescribed. They are a mixture of water and oil and usually contain a preservative. They are especially good for hairy and wet area and are easily applied without a greasy feel. These are also available in the form of ointments. These are made up of oil and little to no water and do not usually containing a preservative. They are great for dry, scaly skin or area with thick skin, like the sole of our feet and the palm of our hand. Gel form preparations are made with water and propylene glycol, a synthetic alcohol. Like creams, they are easy to apply. Solutions, foams and lotions usually containing oil, water and chemicals and are used on our scalp. Minimize the use of topical corticosteroid on the face and inform the patient about the risk. While the reactions are well recognized, they are avoidable. Prescribers are reminded that topical corticosteroids should not be used on the face except for a very short period, that is less than 2 weeks, for inflammatory dermatosis such as psoriasis and eczema that are unresponsive to other treatments. The use of topical corticosteroid on the eyelid or around the eye should always be limited because the skin in this area is particularly thin. Patients should be warned against using any steroid on their face unless advised to do so by their doctor, and that facial application should be limited to 2 weeks or less. The risk of facial use should be clearly explained to the patient. The development or worsening of the dermatitis around the mouth and eyes, or the development of erythema or prominent blood vessels on the cheeks indicate that treatment should be discontinued. Topical steroids comes in a range of strength and are divided into 7 classes based on how strong they are. The strongest steroids are in class 1 and the weakest steroids are in class 7. Class 1 topical steroids are approximately 600 to 1000 times stronger than those in class 7. It is very important to note that the percentage listed on a product label do not reflect the product strength. For example, a 0.01% class 1 topical steroid is far more potent than 3% class 7 steroid. Consider medication options. There are many formulations within each class of topical steroid. First one, topical steroid class 1. The highest potency topical steroid include this group. They are betamethasone dipropionate 0.05% ointment, clobetasol propionate 0.05% cream, ointment or foam, diflurazone diacetate 0.05% ointment, fluocinonide 0.1% cream, halobetasol propionate 0.05% cream or ointment. Next one is topical steroid class 2. These topical steroid group include highly potent drugs. They are amsinonide 0.1% ointment, desoxymetasone 0.25% cream, 0.05% gel, 0.25% ointment, diflurazone diacetate 0.05% ointment, fluocinonide 0.05% cream, gel, ointment or solution, halcinonide 0.1% cream, ointment or solution, mometasone furoate 0.1% ointment. Next group is topical steroid class 3. These topical steroids are considered potent. They are amsinonide 0.1% cream or lotion, betamethasone dipropionate 0.05% cream, betamethasone dipropionate 0.05% lotion, betamethasone valerate 0.1% ointment, desoxymetasone 0.05% cream, diflurazone diacetate 0.05% cream, fluocinonide 0.05% emollient cream, fluticasone propionate 0.005% ointment, triamcinolone acetonide 0.1% ointment. Next division is topical steroid class 4. These topical steroids are considered moderately potent. They are fluocinolone acetonide 0.025% ointment, flurantrinolone 0.05% ointment, mometasone furoate 0.1% cream or lotion, triamcinolone acetonide 0.1% cream or ointment. Next one is class 5 topical steroid. These topical steroids are considered somewhat potent. This group include betamethasone valerate 0.1% cream, desonide 0.05% ointment, fluocinolone acetonide 0.025% cream, flurantrinolone 0.05% cream, fluticasone propionate 0.05% cream, hydrocortisone butyrate 0.1% cream, ointment or lotion, hydrocortisone valerate 0.2% cream or ointment, triamcinolone acetonide 0.1% lotion or 0.025% ointment. Next topical steroid class is class 6. These topical steroids are considered mild acting. These are alclometasone dipropionate 0.05% cream or ointment, betamethasone valerate 0.1% lotion, desonide 0.05% cream, flumethasone pivalate 0.03% cream, fluocinolone acetonide 0.01% cream or solution, triamcinolone acetonide 0.1% cream, triamcinolone acetonide 0.025% cream or lotion. Next and last group of topical steroid class is class 7. Least potent topical steroids are included in this group. They are hydrocortisone 1% or 2.5% cream, 1% or 2.5% lotion, 1% or 2.5% ointment. Hydrocortisone acetate 1% or 2.5% cream, lotion or ointment, and pramoxine hydrochloride 1%. Class 1 is the most potent and class 7 is the least potent. Potency depends on many factors including the drug's characteristics and concentration and the base in which it is used. Appropriate steroid strength or potency depend on varieties of factors. For example, babies absorb topical steroid much faster than adults, so they may be required low potency steroid. Areas of the body where skin touches skin, such as the armpits or under the breast, or sensitive area of the skin such as the eyelid, also absorb topical steroid quickly and may only need a low potency formulation. However, thick rough skin on the palm of the hand and the soles of our feet usually absorb topical steroid more slowly than other part of the body, so those areas typically require a more potent steroid. Topical steroid also have some side effect. Greater the potency of topical steroid, the greater the risk of side effect. Common side effect of topical steroid include skin thinning, easy bruising, enlarged blood vessels, thickening of hair or hypertrichosis, stretch mark in the armpit or groin, burning or stinging where the medication is applied. Okay friends, എടുക്കുന്ന ഓരോ സബ്ജക്റ്റും നിങ്ങൾക്ക് പ്രയോജനപ്പെടുന്നുണ്ട് എന്നുള്ളൊരു വിശ്വാസത്തിലാണ് മുന്നോട്ട് പോകുന്നത്. വിലയേറിയ നിർദ്ദേശങ്ങളും അഭിപ്രായങ്ങളും എഴുതി അറിയിക്കുക, കമൻറ്റായി രേഖപ്പെടുത്തുക. ഓക്കെ, അടുത്തൊരു വീഡിയോയിൽ കാണും വരേക്കും ബൈ.